Hello, everyone. I would like to discuss about common complications after wisdom tooth extraction. Severe bleeding after tooth extraction. The cause may be a disorder of the patient's coagulation system, or the granulation tissue has not been scraped off, or accidental mechanical stimulation, when a gush of bleeding or big black clot appears. A cold water moisturized gauze or a tea bag should be bitten for 30 minutes. If the bleeding still not stopped, you need to contact the dentist or go to the hospital for emergency treatment. Dry socket. A typical symptom is an aggravated severe pain after 2-3 days after surgery. The unbearable pain is caused by the blood clot falls off prematurely and the bone surface is exposed to the oral environment. It is not an infection. No need for antibiotics. Painkiller tablets can be used to relieve pain, and it is usually self-healing after a week. Can also be early intervention, with local anesthesia. A collage plug can be placed and sutured after curettage to form enough blood clot. Sockit gel can also be used to protect the wound to release pain and facilitate healing. The most effective method is to use the Er-Yag laser to remove the bone surface to form sufficient bleeding, and then use the ND-Yag laser to fix the blood clot. Then Photobiomodulation with Geneva handpiece is applied. But the key to prevent dry socket is, there must be enough blood clot formation at the beginning, a primary closure of wound as much as possible. Photobiomodulaltion could also be helpful to reduce the dry socket. Infections after tooth extraction are rare, often associated with a decline in the patient's immunity. Antibiotics can be used to prevent infections in people with immunodeficiency. There must be enough sleep before tooth extraction to avoid fatigue. The infection is characterized by fever, increased swelling, redness of the skin, oral odor, increased pain 3-4 days after surgery, etc. The treatment is to take antibiotics immediately and use antibacterial mouthwashes. Limited open mouth, so-called trismus. The common reason are a stimulation of the needle to the muscle when apply the inferior alveolar nerve blocks anesthesia, or the inflammatory response to the stimulation of the surrounding masticatory muscles, etc. It generally disappears within a week. Photobiomodulation is helpful to prevent and reduce the trismus. Ecchymosis. Old people or young people with loose soft tissues can appear. Bleeding into the submucosa or subcutaneous can be found when waking up the next day after surgery. The purpura can appear on the cheeks, submandibular area, and even the anterior neck area. It is not dangerous and does not increase pain and infection. It is eliminated after 7-10 days, and the warm therapy started on the 3rd day after surgery can accelerate the resolution of ecchymosis. Nerve injury mainly involves the inferior alveolar nerve or the lingual nerve. It is manifested as a numbness of same side of lower lip after the lower wisdom teeth are removed, or numbness of the same side of tongue tip lasts for a long time, far longer than the general anesthetic 4 to 5 hours. The incidence can be 5%, of which 75% can improve or heal itself after 6-12 months. 0.5% is permanent damage. Temporary injuries are mostly caused by mechanical stimulation of anesthetic needles, while permanent injuries are mostly the result of nerve cuts. Photobiomodulation can promote nerve healing.